Developing now on Obamacare, Senate Republicans have put together what they say is the most comprehensive and serious alternative to date. North Carolina's Richard Burr, one of those three senators, with me now from Washington. How are you, Senator? And welcome here.
Great, Bill.
To
Good
HQ.
to be with you.
I want to talk about your plan. I want to talk about your idea, because Republicans have been saying for 3.5 years there's a better way to do this, and this is just going to hurt the economy. And I know you're going to make the case in a moment here that what the CBO put out just affirms your worst fears. Before we go there, though, what the White House is saying is that actually this will give you more freedom. You don't want to work full-time, 65 hours a week. You can work 35 hours a week. This will allow you to have greater choice, and your American dream can come true. What would you say
Bill,
to that?
Bill, you'd expect that out of an administration whose plan has raised the cost of health care for everybody, but yet they say the price has gone down, where 6 million people were knocked off of their insurance, 2 million enrolled, and there are 4 million in the hole right now. Even though this is a snapshot of employment, and it means that Americans are going to work less hours, they're going to make less money, and they're going to pay more for their health care. What Tom Coburn, Orrin Hatch, and I have tried to do is focus on what we should have been focused on this whole time. How do we make health care affordable for all Americans, regardless of what income level they're at or whether they have an income?
Let me get to your ideas, but just one more point on this, because they say it's not 2.3 million who will lose jobs. It's that full-time workers will choose to work part-time. What do you think of that argument? Is that a defense?
Well, yeah, I think anytime you have an incentive for people to be less productive, less engaged in the workplace, you've made a huge mistake. And I think what we've tried to do is put incentives in for people to take some individual responsibility to have continuous coverage, and that's how our plan has been designed.
What will your plan do?
Bill, we basically repeal all the taxes, $1 trillion. We offer tax credits to individuals 300% of poverty and below to help them in the marketplace purchase their insurance. We eliminate the employer and the individual mandate. We create a real marketplace which has at least a 15% reduction in the effects of premium cost, and we empower individuals to go into the marketplace and pick a plan that meets their age, their income, and their health conditions, which I think puts them in charge of their health care. I might also say we extend the same benefit to individuals on Medicaid that are not pregnant women or children or elderly or disabled. We'll let them take the tax credit if they want to and purchase coverage in the private marketplace, making it even more competitive.
Yeah, I know it's three Republicans with the idea. Do you have any Democratic colleagues who have come to you, whether on the record or off the record, and said, Senator, that's a great idea? I think I can get behind that.
Bill, it's been amazing to see healthcare economists around the country of all stripes look at the plan and say, geez, there's some really good things in here. But this is not a bill that we introduced. It's a draft piece of legislation that we went out and solicited people to give us their best ideas, give us their comments on it. You know, the president said the other night he's got a phone. I just hope he learns to use it.
So I did not hear a clear answer as to whether or not any of your Democratic colleagues think, Senator, you've got a good idea. Do you have any support from the other side?
Bill, I will tell you there's a lot of interest. I don't think there's any Democrat that's publicly going to go out and say, I'm ready to throw the Affordable Care Act over, because this is the president's signature legislation. But I think it's time that we start talking about real solutions that bring the cost down and reassure the American people that coverage is in their future if they don't have it today.
Thank you, Senator. We'll speak again.
Thanks,
Richard
Bill.
Burr from Washington, D.C. Appreciate your time.